Lipstick ಹಾಕಿದ್ರೆ ಏನು Hi, welcome to this unique hair care initiative by IPCA. I'm Mona Sharma, and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory, and it makes a world of difference to our appearance. However, our hair also requires special care and attention. Hi, welcome to this unique hair care initiative by IPCA. Earlier, it used to be a sign of middle-age problem when you used to lose hair or have hair problem like thinning of hair and bald patchy hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problem even at a younger age. It's not uncommon now to see 25 to 35 years old people facing hair problem. Most of this problem, if identified early, can be managed well and much of the hair loss can be avoided. Most of these issues are related to our faulty lifestyle. Today, we have with us Dr. Seema Srinivasa. Is a well-known doctor based in Bangalore who specializes in dermatology. She has been practicing medicine for over 14 years now. Dr. Seema Srinivasa currently practices at Dr. Seema Skin Care and Laser Center at Rajarajeshwari Nagar, Bangalore. She has completed her MBBS from Siddhartha Medical College and Research in 2001. She has done her MD in Dermatology from MVJ Medical College and Research in 2013. Her clinic provides various services like dermatitis treatment, skin rejuvenation, bacterial skin infection treatment, to name some, dermoscopy and skin peeling. Dr. Seema Srinivasa is aware of the need for the patient awareness and education about hair care. And hence, she has spent a lot of time in giving talks at various platforms across the country. Thank you, Dr. Seema Srinivasa, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to the show. Doctor, हमारे साथ जुड़ने के लिए बहुत-बहुत शुक्रिया. So, Doctor, today we are going to discuss the role of nutraceutical in hair care. She spent a lot of time in giving talks at various platforms. So, Doctor, your first question is, we face hair loss problem very commonly, and even when we wash our hair, we face hair loss problems. So, what's normal and when to be concerned for? Doctor, you're mute, so you can unmute yourself.
Yeah. Good evening, everyone. Thank you, Mona, for hosting me.
Yes, ma'am. Yeah. So our first question was...
I got your first question. So in our OPD, we get a lot of patients, especially both male and female, equally nowadays.
You're mute, so you can unmute yourself.
Again. Good evening, everyone. Thank you, Mona, for hosting me. Mona, I think there's some technical glitch. I'm hearing you twice and I'm hearing myself twice. If you can just fix that.
Yeah, hello, ma'am.
Yeah.
Ma'am, is there a YouTube live open at your side?
At my computer? No.
Yes, ma'am.
Near me? Yes.
Other than Zoom meeting, I think there is a
Okay,
YouTube
just
live as
one
well.
second. I'll try to think. One
Yeah.
second. Mona, I think there's some technical glitch. I'm hearing you twice. I am hearing. Did I go off?
No, ma'am, you're not. You're still alive.
You're okay. Just
yeah.
I'm just trying to find you. Yeah. Perfect. So shall we go on?
Yes, ma'am. Go with your first question.
You did ask for what is hair fall or what is hair loss and what is the usual number, what is normal hair fall, and what is when do patients come to us saying, yes, we have a lot of hair fall when it's abnormal. So we do get a lot of patients, both male and female, equal nowadays, especially post-COVID, which was one of the major triggers for hair fall. We get patients on a day-to-day basis, usually for both male pattern hair fall or hair loss and female pattern hair loss. So in female pattern hair loss, again, there are many things such as telogen effluent, that is suddenly they start losing hair. These things are associated with any trigger. So if they've had any illness, if they have any hormonal changes, then there are chances that they start having excessive abrupt hair fall within the next 2 to 3 months post that trigger. Normal hair loss is somewhere between 50 to 100 strands every day. Whenever there is more than 100, it becomes quite alarming. This is still an acute phase. There are sometimes where we call it a chronic telogen effluent, where we start seeing more than 100 up to 1,000 hair fall. They start saying that our drains are getting clogged with my hair. When I shampoo my hair, when I condition my hair, or even when I oil my hair, I do face a lot of hair fall. There are patients who come to us with a bunch of hair tucked in their handbags to show us, see, this is how much hair I'm losing. I may even go bald in the next 2 to 3 months. So how can you help me? So we have to first know to assess what is normal hair loss, what is abnormal hair loss, when do we need to treat it.
Okay, so ma'am, what's normal and when to be concerned for? Like, when should we know?
50 to 100 hair is still normal. Okay. When is it abnormal is when you start seeing more than 100 hair, when you start seeing hair falling all over your pillows, when you start having sudden abrupt hair fall, like all these years you're fine, you're a healthy individual, suddenly you start losing hair. And then if you have any hormonal issues, then you can associate with that. In males, it's usually male pattern hair fall, hair loss, what we call as androgenetic alopecia. So we have to consider what is the age of the patient, how often are they losing hair, how much hair are they losing. Only based on that, we can assess whether there's an abnormal or normal hair fall.
Okay, so that means 100 से 150 तक अगर hair loss है तो normal है, but अगर इससे ज़्यादा हो रहा है तो it's time to visit the doctor.
Okay. Yes, usually what we say, there is a normal shedding that happens, seasonal shedding. Usually from the month of July to October, you see a lot of patients with hair fall. So that is your regular hair cycle, which is, going through the growth phase, resting phase, and then falling off phase. That is still okay. It is only when it becomes prolonged years together, you're continuously having significant hair fall, or suddenly next 2-3 months you have hair fall, then you have to be concerned.
Okay, that's quite informative, doctor. So our next question is, what are the general causes of hair loss?
Okay, general causes of hair fall, there are various reasons. First and foremost is genetic. Like I said, female pattern hair loss or androgenetic alopecia is usually genetic. If your parents or your father especially has some degree of baldness, then there is higher chances of you also experiencing the same thing. That is again included with hormonal changes. If they have high androgen levels, then that can cause a lot of hair fall. hair fall. In women, there can be a lot of pre-existing conditions or underlying conditions like PCOS or hormonal imbalance. They have a loss, even during menopause, women tend to have less estrogen. That has been shown in multiple studies that they can have hair fall after a certain period of time. Other triggers are your stress, a lot of emotional stress. Now we see a lot of IT people who are going to, working from home or going to offices coming to me saying that they have hair fall all the time. So that is mainly because of their emotional stress and because of their diet. Diet, if it is not rich in your proteins, if you're not taking adequate iron supplements, or if you have iron deficiency, anemia, all these can be a causative for hair fall. The other things are certain drugs. That is, if you're going through chemotherapy, if you're going through some cytotoxic drugs, then that can also lead to hair fall. Thyroid plays a major role in hair fall, both hypothyroidism as well as hyperthyroidism. You have to be a little careful whenever patients come to you. You have to make sure you get their thyroid profile done, their hormonal assay done, so that we can treat them better and in a more organized fashion.
Okay, so that means stress, hormonal imbalance, everything can lead to the hair loss. So it's like men and women equally are affected from the hair loss, or it's like
nowadays we are seeing that very common. Usually we used to see more men being affected. Even now there is men are more affected. That is, your male pattern baldness has always been there. But now these days we are seeing diffuse hair fall in the form of telogen effluent. That is sudden hair fall, especially in women who are stressed out, women who have given birth 3 months after birth, postpartum of postpartum period, they tend to have a lot of hair fall. If they have thyroid issues, especially in women, we've seen a lot of women also being affected with hair fall.
that's quite good, ma'am. Good to know that men and women, even men, are also affecting from hair loss. So we'll move to our next question. Like, we all have unhealthy, nowadays we all are facing the problem of unhealthy lifestyle, late working hours, eating junk food and all. So can a person's lifestyle also play a role in hair loss?
Very significant role is what I would say. People who are unhealthy, not eating well, who are anemic, who are malnourished, or not taking sufficient amount of vitamins, minerals, as well as proteins, do face hair fall quite significantly as compared to others who are eating well. People who don't exercise, who don't have a regular balanced lifestyle, we've seen them having, because all this imbalance in lifestyle leads to imbalance in hormonal changes, right? So all these are connected. So the minute you take care of your lifestyle, your balance, and then that does not affect your hair fall. So diet, yes, does play a role. Your diet should be rich in protein, either animal source of protein, plant source of protein. You should make in the form of sprouts, in the form of your pulses. You can start consuming more of it as per the recommended dosage. You have to start increasing your diet in iron food like your green leafy vegetables. You have to add certain amount of biotin also in your diet. This will stabilize the hair fall. It will make sure that you don't have prolonged hair fall.
Okay, so diet is the main thing to be concerned for. If we follow a good diet, we can.
I wouldn't say main, but yes, definitely one of the major issues that influence hair loss.
So, doctor, we have diet, customized diet plan for various disease management. So, is there any customized diet plan can be done with the doctor for managing the hair loss?
Not really. If you can increase in your proteins and your biotins, I think that will be more than enough. You need not overload the patient on a lot of proteins. You need not overload the patient with multivitamins. Recommended dosage will be more than enough. If you can get it through your diet, well and good. If you can get it through your supplements, that is also fine.
Okay, so excess of everything is bad. Yeah. So, doctor, we'll move to our next questions. So, what are the medical treatment and options available for hair loss, like topical, surgical, non-surgical, or is there any oral treatment also available?
Yeah. So when it comes to hair fall, usually we start off with oral treatment. Oral treatment can be in the form of your multivitamins, and even for men, it can be in the form of anti-androgens to reduce their androgen levels so that it doesn't act against or increase hair loss. So these are the two things we mainly focus on. Multivitamins, there are various new things that's been introduced right now, various molecules that have proven to be beneficial and works well, like your biotin, your minerals, your simple iron supplements, your vitamin D3 supplements. Even B12 deficiency can cause hair fall. So taking care of that and supplementing the patient with that has shown great results. When it comes to topical treatment, it's always been minoxidil and non-minoxidil based. Minoxidil for usually women, we start off with a very small percentage, that is 2%, slowly increase about 5%. But whereas for men, we start off with 5% and slowly increase. We've also added fenestride in the latest topical ones, who especially for patients who do not want anti-androgens in the form of fenestride. Patients are quite skeptical about taking oral fenestrides. We have added it topically, which have no side effects at all. So oral and topical are these. Along with this, I would recommend your platelet-rich plasmas, where we are injecting and giving nutrition to the site or the hair follicles itself. Along with that, growth factor concentrates have also been used, have shown good results. It is again a combination, just not a standalone. We cannot just give PRP and not give oral and topical, or just give growth factors and not give that. So what we try to do is we give a combination of them so that the patient gets faster and better results. Then comes your surgical one, where you have your hair transplants and follicular unit extractions. But even for that, you have to maintain the patient on oral, topical, as well as your PRP and growth factor concentrates. That will give you far better results than just going on a monotherapy.
Okay, so Bam, I mean, that was quite informative, and I'm like oral is also available, and people also wants to go more for non-surgical treatments. So, like people get scared of syringe and all. So it's PRP is safe, but like what's PRP like?
PRP is definitely safe. It is the leading treatment now for hair loss. But we also have to understand that not every patient does not want PRP, only because it's minimally invasive. The very thought of injections and pricking and piercing tends to scare the patient. But since we use their own blood to extract all the growth factors, it is still one of the safest methods for hair growth.
Okay.
So there's always a set of patients who do not like invasive methods. Then we have to stick to topical and oral.
Yeah, but PRP is getting, a lot of focus. So it's good to go for PRP also. Patients do not need to worry about it. Yeah. So, doctor, we'll move to our next question. So, nutrients are really important, and we do not have nutrients in our food culture of nowadays. So, what's the role of nutraceuticals for hair care? What's nutraceutical actually?
So these are supplements, basically supplements that have been introduced into your diet so that it can give better results. There have not been any proven study that says that, these alone will help you. Like I said, in combination will definitely help.
Okay. So combination is the key. So, Doctor, like another questions we wanted to know that the role of what's the role of micronutrients in the hair care? There are macro, there is micro. So, what's the role of micronutrients? Actually, like what is micronutrient and how does it play the role in hair health?
So these are all basically there to increase your hair growth, reduce your hair fall, and also increase the growth phase. So what they do is they help in providing nutrition not only to you, but also particularly to the hair. So this increases in hair growth. So that is how, your micro and macronutrients play a role in this.
So these nutrients cannot be taken in that,
preferably through supplements will give its preferred recommended dosage.
Okay, so that means supplements are really important to get our appropriate amount of micronutrients for the hair health. Okay. So, doctor, is it required to take the nutrients as per RDA gender requirement?
Definitely. Definitely. Anything in excess is just going to get excreted out of your body. So the daily recommended dosage for men and women are always recommended there, and that is what should be given. Anything more than that is useless. Anything less than that will not really help you.
Okay. So, like for this kind of for the nutrients requirement, should not take it by ourselves. For this, also we need to visit the doctors and get it
Yes.
done. Okay, okay, okay. So nowadays everyone is facing a problem like dandruff. So does dandruff really lead to hair fall?
See, what is dandruff, first of all? A lot of people have a misunderstanding about dandruff. They feel dandruff is because of dry scalp. They feel dandruff is something else. So, usually, what happens when there's excessive sebaceous oil or excessive sebum production on your scalp, it becomes a very nice environment for fungus to grow. So, fungus, in combination with your oil, is what causes your dandruff. On top of that, you're constantly oiling your hair, thinking it's because of dry scalp, is only going to aggravate the situation. Any form of dirt or any form of debris that is clogging your pores or hair follicles is bad. So that can cause hair fall to a certain extent, but that is not the only causative factor for hair fall.
So, doctor, for this, when we have dandruff, we try to, use gharelu nuska and all, and because, different kind of gharelu nuska like lemon, use lever or something, and the itchiness
Onions.
will go, the hair fall will go. So, does this really work, or we should not do overreaching or not use the over stuff and
I
use it?
wouldn't recommend any of these home therapies or home remedies because I would say instead of applying that all that on your hair, please eat them. That gives you a better result than applying it and cause. Sometimes what happens when you apply onion or garlic or whatever that is there, even curds to an extent, it can lead to secondary infections. In not just infections, you can have contact dermatitis. That is, you can have sort of an allergy to these topical products. So I would always say go to your doctor as per what the doctor recommends you have to use. Don't try the home remedies. We've not seen any result, and there hasn't been any proven study that shows that any of these work.
Okay, so the key is to visit the doctor, get the right treatment, and get the problem solved. Okay, so doctor, even with dandruff, there is a lot of stress also in our lives. So, what impact stress does in our hair health?
Definitely. Like I said, stress has a major role in hair fall. That is when it's not related to your, hormone related hair fall. I'm not talking about AGA or, your female pattern hair loss. I'm talking about telogen effluent, especially. That is your sudden hair fall. We've seen a lot of patients who come to us with a sudden emotional stress or some kind of anxiety, depression they're going through. 2-3 months later or the months after that, we see a lot of hair fall in these patients. There has been studies that have proven that yes, it is psychosomatic or rather, stress related. This is something that we have to keep in mind. And what really helps, Mona, is talking to the patient, counseling the patient, telling them, see, stress can cause hair fall, trying to have at least about, 10 to 15 minutes of counseling with the patient, trying to tell them, okay, this is how much hair fall is normal, this is abnormal, this is how long it's going to take for you to actually start seeing results, and this is how long you have to take the treatment. When all of this is explained to the patient compliance increases drastically. Once the patient understands what is actually going on and what is the root cause behind it, it's easier for the patients to take treatment also, because this treatment is not for a month or two. We have to at least give it till they finish one hair cycle. That takes about 6 to 9 months. So counseling plays a major role in cases of hair fall.
Okay, so that was quite informative, ma'am. So we just wanted to know also that like for like stress can cause hair problems and hair loss. So whether if we take the supplements for hair health, whether and if we not try to manage the stress. So whether
Useless.
still okay, so
I
it's
wouldn't say
useless. So
useless. I wouldn't say useless. It's like half treatment, incomplete treatment. So at
okay.
one side you have your stress which is going on causing hair fall. The other side you're trying to curtail it by giving supplements. But we need both of it. We need supplements. We also need you to be stress free. So
Okay, so that means
all of my patients counseling is important, or any patient, you have to tell them, first de-stress, along with that take your supplements. That is when you see the best results.
okay, for the best results, we need to manage our stress and also take care of our hair health with the right amount of nutrients and supplements. So, doctor, from dandruff to hair stress, earlier, like our dadi nani used to say, apply oil. That will make your hair very good. बहुत अच्छी shine and all आएगा. So is it like really like oiling is a ban or a boom? Because I've seen youngsters don't apply oil at all.
Yeah. So it's oiling is more of a Indian custom thing. Like we've been so used to growing up oiling our hair. We've been so used to, leaving it overnight. Like I said, one of the reasons why I wouldn't say stop oiling, but I wouldn't encourage my patients to oil, especially leave it overnight, leave it on the scalp for a couple of days, is only because oiling, like I said, you're already producing enough oil for the fungus to grow. On top of that, you oil your hair, chances of dandruff increasing is there. And also it can lead to a lot of acne. It may clog your pores and lead to acne. I wouldn't say stop oiling, but half an hour before bath, once or twice a week is still fine. Oiling as such does not have any major benefits, but yes, oil massage. When you massage it, you're stimulating a lot of, blood flow to the follicles. That plays a minute role in increasing hair growth. Other than that, it acts as a protective sheath onto your hair shaft, which it saves you from your harsh sun or your chemicals or your pollution to an extent. But it can also complicate by keeping the dirt and grime in your hair and causing a lot of infection. So I wouldn't say ban or a boon, but a bit of both.
Okay, so okay, bit of both. But ma'am, what's the right technique? Like, should we apply it on the scalp or it just like to
I
the?
would say not to the scalp, to the hair shaft.
Okay.
Okay. If you're applying it to the scalp, it's only for massage. But I would say completely not really recommended for the scalp or the roots. I would just ask you to apply it to the shaft, leave it for a few hours or just half an hour to be precise, and then washing it off is more than enough.
Okay, so apply to the hair shaft, not to the scalp, and wash it before apply and wash it off. Yeah. So, ma'am, is there any important tips you would like to give for the healthy hair? What important tips?
What I would say is first, once you go to a doctor, why I would recommend you going to a doctor is the doctor will be able to find out what is the cause behind your hair fall. It can be genetic, it can be because of hormonal changes like your thyroid hormones, can be because of iron deficiency, can be because of nutritional deficiency, can be because of any underlying causes, such as, some cancerous causes. So you never know what the cause is. So once you go to a doctor, either through blood tests or on examination, we'll be able to fairly come to a diagnosis why this person has hair fall. Once we know that, we'll be able to guide the patient in the right way, whether they have to take only nutrition or macronutrients, or whether they need supplements in the form of biotin, or whether they need anti-androgens so that their hormonal imbalance is in check. At the same time, which topical treatment to give, whether they are allergic to certain topical treatments like minoxidil, whether they are allergic to certain topical treatments like caffeine or procapil. You never know what. So based on the patient examination through trichoscopy or this one, or just on examination, we'll be able to come to some kind of a conclusion on how to treat the patient better so that they have the best treatment and the best results.
Okay, so basically, it's important to visit the doctor and get the treatment. Do not do it by yourself. It is always better to
Always
visit
better.
the doctor. Yeah. So this discussion was very informative, and I'm sure our viewers would be benefited by it. So, Doctor, can we take some questions from the live audience? Okay. So, Doctor, your first question from our live audience is, what is the best way to prevent heat damage? This question is really like all females want to know, because we all iron our hairs, so, and even the sun. So yes, ma'am. So what is
So
the best?
again, we have to first identify what type of heat damage, whether they're talking about sun exposure, the sunlight that is causing the UV rays that is causing damage, or it is the ironing and all the appliances that you had, tools that you're using to constantly style your hair. So yes, both of them cause a lot of hair damage, especially to the shaft, which leads to breakage of the hair. Right. So usually what I would recommend is, whenever you're in a tropical country like India and you're constantly going out in the sun, a wide brim hat or a cap will actually help with sun protection to a very large extent. Wearing a scarf or not exposing your hair to direct sunlight does definitely help. Secondly, when you're using your ironing or your straighteners, I would say always use a heat protection a serum or a lotion beforehand. Even if you use it, you're still going to have a lot of breakage. I would especially not encourage it, but once in a while is still okay.
Okay, so once in a while is still okay, and for
Not on a regular basis.
Okay. And all those chemical treatments also lead to the heat damage.
Lot of shaft breakage.
Yeah. So
You're going to have brittle hair, you're going to have frayed hair, dry hair with a lot of, breakage in between. This is something that can't be repaired. You'll have to wait it out till, your hair grows or finishes that cycle. So I wouldn't recommend it.
So for our viewers, do not go for chemical treatments. If you go out in the sun, please wear a scarf, cover your hair. And if you use the heat treatment on your hair, then please apply some serum to protect your hair, and then do the heat treatment. Okay. So our next audience is asking, can caffeine affect the hair loss?
Taking it or topically, because now we have
Like,
topical caffeine.
yeah, actually, we people, Indian people, always tends to drink tea, coffee, a lot of tea and coffee. So I think so.
There has been proven green tea helps in hair growth, but we don't really know how far that works. But caffeine, not really. I mean, it does not encourage hair loss, or it does not encourage hair growth.
Okay, and also people apply caffeine, like put caffeine in mehendi, and then they apply to their hair. So is it like okay? The third question from our viewers is, Madam, my brother-in-law is 36 years old, and when he stopped taking medication, he gets hair loss. And he's now taking treatment for hair more than 5 years, and how long he should continue?
So see, hair fall, especially when it's a 36-year-old male, I'm assuming it is androgenetic alopecia. This is something that he has to maintain for the rest of his life. As long as he wants hair on his scalp, he has to take treatment, because it is not because of the stopping the treatment that he's having hair fall. It is a natural course because of his genetics acting against him. That is when you start having hair fall. And for that, you cannot suddenly take treatment for a while and stop it. There are ways to taper it down, but you cannot stop treatment.
So alopecia is a problem where you have to take the
androgenetic alopecia.
Yeah, you have to take the treatment for lifelong. Okay, so our The viewer is asking, I have been taking vitamin E tablets for a few days. Will it help to get rid of hair loss? Few days. Yeah. No. Okay. So, is there any vitamin E? Is there is it
To a
really
small
important for the
extent,
hair?
yes. To a small extent is always good for your hair growth, for your skin rejuvenation, for a glowing skin. But vitamin E alone has not proven to cause hair growth.
Okay. So, okay. So she
And
must.
few days, it does not do anything.
Okay, few days. Okay. Yeah. I think she might have get the answer. So we move to our next question. Another viewer is asking, how does hair take in nutrients? I mean, he must be asking like how the hair gets the nutrients, like from where it can
Through
get
blood
the
supply.
nutrients. Yeah,
Blood supply.
blood supply, and how to improve it,
It
how
goes
to
to
improve the
it
blood
goes to
supply.
the hair follicles. So
Okay.
once you take your nutrients, it is taken up by the blood, and then it goes in. There are various pathways. Obviously, I cannot explain the pathways,
Yes,
but through
yes.
blood, and then it goes to your hair follicles.
Okay, so for nutrients, is there any exercise or something where we can increase our blood supply? And
There is no exercise. Regular exercise helps.
okay,
So it is not like you stand on your head or you stand on your hands and then you're getting more hair, blood supply to the hair and suddenly you're getting more hair. It does not work like that. Regular exercise releases a lot of endorphin, serotonin. All these play a role in increasing hair growth. But there is no particular exercise that increases hair growth.
okay. So there is no particular exercise, but exercise is good for health. So we should keep doing exercise. So Dr. Now there's one interesting question from another viewer. Does hair spa reverse the hair damage?
No, it can help soothe it to an extent, but no.
Okay, so no to hair spa or like
Go ahead and get a hair spa whenever you feel like pampering yourself, but don't expect your hair spa to save your hair.
okay. So if you have a hair problem, it's best to visit doctor instead of believing hair spa. Okay. So another question from our viewer is any tip for getting rid of split ends?
The only way to get rid of split ends is making sure you don't get split ends in the first place by taking care of your hair, by not using any heating tools, which leads to fraying of the hair or split ends. Cutting, regular cutting helps in the split ends.
Okay. So now, as we're running out of the time, ma'am, Dr. V, I would like to ask you the last question from our viewers. This viewer is asking, her daughter have a white hair and she's very young.
Mm-hmm.
So why she have a white hair at the young age?
How old is she? Any idea?
She's I think so young.
No
yes, he said school.
problem.
Going to school.
Yeah, usually what we see is early graying or premature graying is very commonly seen nowadays, especially in young adults. What we feel is, like I said, lifestyle modification, their diet, their stress, how they deal with day-to-day activities has led to premature graying these days. And also genetic plays a role. Like in case you have a family history of early graying, then there are chances of you also having graying at a very early age. So all these do play a role in causing premature graying. So have a healthy lifestyle, eat well, work out, have a stress-free life. Especially, these school-going kids are, when they have exam tension, when it's all related to their boards, they tend to, have early graying. I would say relax and, not worry too much, and that reduces stress-free life, always reduces graying, hair fall, and it gives you better skin.
Okay, so the key is eat good nutritional full food and take care of your health, and everything will be fine. So, Doctor, would you like to give a take-home messages or any suggestion to our viewers today?
Regarding hair loss?
Yes.
Okay. So when you do have hair loss, I want the patients not to panic. So half of the hair loss is because they're stressed out about hair loss. So you have to understand that there is help out there. There's the right kind of help. Make sure that they take the right kind of help. They seek doctors, they seek dermatologists, they seek nutritionists who are able to guide them on what to eat, what medicines to take, how to take care of their hair on a day-to-day basis. So there is enough guidelines, but again, it's the right guidelines that they have to choose to take. So there is enough help out there. They let them approach their dermatologists, their trichologists, and they'll be able to guide them and make sure that they don't stress about hair fall much.
Okay, so stress-free life, visit to the doctor and get your hair problem solved. Yes. So thank you, doctor, for sharing so much of information and all your expertise with us and for answering all the questions for our viewers. I'm sure viewers have found this session very helpful. Thank you, doctor, for your valuable time, and it was a delight to have you.
Thank you. Thank you, Mona. You've been a great host.
Thank you so much, ma'am. Thank you, ladies and gentlemen, for joining us